Well, of course, first, it's my pleasure having me here. And I think George is a little humble, because if you look through the phone book in Brussels and you look for the NHS, it says only one name. It's the UK, Scotland, and it's always George Crooks. So, I mean, these are the shortcuts you have to make if you find your way in Brussels, and then finally you see how it works. I think it's an interesting perspective that not being from a medical background, as an entrepreneur, and that is also maybe the slight difference you can notice between basically the healthcare system you see in the Netherlands and the UK. I mean, we lost our NHS like 10 years ago when the government at that time decided that we will go for the market. So we privatized most of our healthcare system, and we're now struggling, and it is struggling with 4 financial institutes called health insurance companies. And basically, due to the financial pressure over the last few years, they're taking a shitload of money out of our healthcare system and just building up all kind of compliancy back reserves and all kind of balance sheet guarantees which you will be needing as a financial institute now. So we spent like 45 billion euros over the last 5 years to build up the reserve in these balance sheets of these insurance companies, and that has all been detracted from our healthcare delivery system. Another interesting comparison is that Scotland, with more than 5.5 million inhabitants, compares to our region, which is only 2 million. And then Scotland spends like 12 billion pounds, but we spend 10 billion euros on only 2 million people. So we definitely have a problem in the Netherlands that we have our system out of bounds over the last 20 years. So we are in a position where we have to take some dramatic measures to make the necessary transformations, to keep, on the one hand, keep the system running, but on the other hand, to do some very disruptive changes to make sure that we are on a path that keeps the system sustainable also for the next generation. So these are some big challenges. And the interesting thing is that if you are facing these kind of societal challenges, we think that it's quite important that you're not trying to manage these changes only from a public policy or a public perspective. So my background as an entrepreneur has always brought me in a position to question myself, where are my customers, where are the demands, and what demands are going to change over the next 10 years, and how we're going to move forward in a new market. And when George was just explaining the way you have to handle the Commission in Brussels, basically it's about what is the demand. I mean, which are the very basic thought of where are your market needs, where are your customer needs, because also Brussels, the European Commission, is also a customer you have to treat in a way that you serve their demands, and if you do that in a neat manner, they'll serve you as well. And I mean, that's a kind of two-way street, as George already explained. The way we approached it in Eindhoven, and just to put it in a little perspective, I'll just give you a little hint on what you should expect about our region. And then basically the Netherlands has 3 major economic clusters. So we're making money in the Amsterdam area, where we have these big financial institutes, so that's financial services. We have a very high volume, low value turnover in our traditional port industry. That's Rotterdam, used to be one of the bigger ports, but we lost that one already a long time to the Chinese. But that is a kind of industry where you drive a large turnover, but a very low value, which you can directly put into your local economy. So that brings you to the third and, of course, most promising part of our economy, and that is not by coincidence the Eindhoven region, which is an area of traditional manufacturing industry, where we had the former Philips companies. But in the last 20 years, we made quite a dramatic change, and we are transforming from a traditional low-value manufacturing industry into a high-value knowledge economy. And to do that, we put in place some interesting systems, which, as a very small region, because we are only with like 750,000 in the larger Eindhoven region, we are using and implementing some principles which I think are also very interesting to look at in the broader perspective. There we go. Consider Eindhoven with more than 1,000 small and medium companies, all focusing on high-tech, in 3 major areas. What can we do facing the grand challenges of energy, mobility and healthcare? These are the 3 major areas where we make our money and where our industry is flourishing. The second thing is if you're small and you have only a relatively small amount of money to be spent on research and innovation, you have to do that in a very smart way. And in the past, we used to do that in a very isolated way. So Philips had a large research facility. They closed it, they built big walls, and they're just operating their own research facilities. Nobody in, nobody out, and try to find the right way and how are we going to put these products on a global market. And that is even for Philips, and as you are aware, they're even splitting it up, so it will be smaller again. And that's no longer a global company. Although, if you can make it global, if you can expand the reach of your research efforts into a broader perspective. And it was only like 6 years ago when Philips moved its head offices from Eindhoven to Amsterdam, they made one strategic decision. And that is that the research facility they had, which was a closed facility, they opened it up, and that is based on the high-tech campus in Eindhoven, and it became an open innovation research center. So that means no longer is Philips only benefiting from the research efforts they do there in a very close cooperation with local universities, and in fact any academic institute in Europe, but they decided to open it up and to share that research effort both on the burden but also on the benefit side with other companies. So we now have open research institutes where you can more or less engage as a small or large company in a specific part of their strategic research. You are entitled to share the outcome of that research, and we call that open innovation. Open innovation is not free ride for everybody. I mean, you have to engage, you have to commit, and if you are committed on a certain part of that, you're also entitled to the outcome of that. So you see the interesting way that Samsung and Philips and Siemens are very, as colleagues working together on the fundamental research side. Again, they take out of the IP of these research programs and they put it in their own products, and then they become competitors again. But that means that you can do a bigger chunk of research in a global market instead of doing it all of your own. And I think that principle can be identified in any step we take, and also in the way we organize our present network as we are trying to address some changes in the healthcare market. And obviously, if you're high on research, you also have to have a high private spending on research. I mean, it can never be public money funded try to drive these changes. If there's no market by the end of the day or the end of the month, if there's not a payer, I mean a private payer, it can be a consumer, it can be a cluster of consumers, can be a local or regional government. There has to be a high spending of research money, and that should come from public and private side. So we are believers, and even we invented a model which is called the triple helix. The triple helix is the basic principle of bringing together public bodies, educational institutes and private companies to share the burden of research and innovation. Well, and my experience, long time, 30 years as an entrepreneur, is now being extended a little because I have been an elected member of our regional government since March, so now I'm also start to look at it from a more public policy perspective. So maybe it makes me a little more easy for me to identify with all these people I sometimes work with and struggle with, especially in Brussels, George, because it can be also a very big legacy if you try to find your way. You have to do that in a very efficient way. And we do that together also with our regional government. So if you're on a regional base, because Eindhoven is not the same size as Scotland, Eindhoven is only a smaller part of one of the provinces of the Netherlands. So we do that in a very neat, aligned way. We try to make sure that we don't do these efforts, we don't double the efforts, and we make sure that we have a very aligned agenda who takes care of these international contacts in Brussels. We have a very small, efficient office which we can share. So it's all about sharing and multiplying if you are in a relatively small organization. And obviously, if you want to compete on the global market, and that's where it's all about in our region, if you want to make high-tech available on the global market, you cannot cover the whole world. So you have to be selective in where are you capable of organizing your efforts in an academic way, but also from a private perspective in such a way that you are capable of competing in the global market. Because the Netherlands is no market for our local businesses. And if you look at these 200 or 400 startups in your backyard, they also have to compete on a European, on a global market. So everybody has a look to the outside, and that also means this: you have to be very selective what you do and what you don't. And that's all about making choices in life, and that means also from a public perspective, we have a very strong selective program. Where do we invest our small money on the table, in which industries, and also specifically within healthcare as well, which health tech equipment is part of our agenda and which isn't. We're not in biosciences, we're not in life sciences, we're not in the broad arena of what you can do on every aspect of well-being and health. So we are specifically focusing on the tech side. Everything with a sensor, with an algorithm, where you can do something on a distance and you can do it eventually in your smartphone, because that's where all that technology is going to end up. That's where we're good in. And on the other hand, we realized if you're going to drive these developments and research programs, you always have to bear in mind, by the end of the day, who's the customer? That's where I started my presentation. So it is not by coincidence that over the last 10 years, the design industry in Eindhoven became world famous, because we had to develop another capability, a fully different discipline compared to all these beta type of guys on our technical universities, to make sure that we have the right perception about how all these technologies will play an important role in the daily lives of all these people who are, by the end of the day, meant to be our final users. And the definition of an end user, and our mayor Rob van Rijssel, he always mentioned that the systems of development and innovation are inverting. So it's not the end user, it's the user at the beginning. So if you start designing and developing and researching, they should be there at the beginning, and by the end of the day, they're also the natural or the organic users to work with these technologies. So we changed the area, and we also changed Eindhoven. We gave it the shape of a big living lab. All the citizens in our region are actively participating in all kind of large-scale trials. It can be for a single device test we do on e-health, or try to connect everybody on a kind of telehealth center. It is mainly in the public-private field that we also try to engage all of our citizens in a certain way. So if you're suffering from a chronic condition and you are 65 plus, almost 80% of our citizens are in one way or another engaged in one of these large-scale, and I won't call it experiments, we call it deployment initiatives, because it's not about testing anymore. It is about how are you going to unfold these large-scale deployments. If you're running projects, you're running temporarily initiatives where you pour in some money, and you hopefully by 2 or 3 years you find some results which makes it beneficiary to continue. If you don't find the money, the project stops, and also the innovation sits on the shelf, and nothing's going to happen. And you're wasting a lot of money on there and effort on that. I just skipped these. We, of course, obviously we're all facing the same trends, and we're all facing this trend, and this is one important, particularly important for our region, because we have an industry which grows like 2 or 3% above our GDP growth on a national level. So our labor market is very much touched by the high demand of many personnel. So the graying and the aging demographic developments are putting a double pressure on our local economy, because it's not about a shrinking labor market, but it's also about people we need in our core industry. So we are struggling, and we are finding people everywhere in the world just to make sure that we have the number of talent available in our region. This is your specialization, so I will not cover that one. But this is, I think, the most interesting one. Basically, the Netherlands is in a very dramatic way pushing healthcare delivery as much as we can, and George put it in 4 nice objectives. We try to push it away from our hospital ER environment into the home or community environment. And that is this is not an intention, this is happening right now. We closed most of our elderly care facilities by the 1st of January from this year. We are putting a lot of pressure on our local communities to take care and to reinvent the system of social care and community care. So we are in a very dramatic way there's like a 40% budget cut on our elderly care system as per the 1st of January of this year. And obviously many people are suffering. There are many complaints, but on the other hand, the only way to find some disruptive changes in a system, if you take out these numbers of percentages of money. Because if you just use the scale and take 5% here and 2% there, everybody's going to redesign, make a little more mean and lean type of organization, and we make a next step and we survive, and next year, next round. So that's the way it normally works. But this is pushing, and this is also in a very a nice way, more or less putting pressure on the substantial use of technology, because this means that if we can make use of technologies which will drive healthcare or diagnostics or more monitoring over from a hospital to a GP, but even beyond GP at a home level, and as you are aware, Philips is in this area as well, represented with a big facility. Philips is transforming from a clinical hospital type of organization into a healthcare delivery organization, which is mainly focusing everything which is happening also outside of the hospital. So we see a shitload of technology hitting the market. We're all struggling, especially medical doctors. How are we going to use it? To what extent are we going to allow these new devices in our hospitals or in our hospital environment? What are we going to do? How do we have to change our regulatory systems to adapt to these new technologies, which bring in all kinds of facilities and possibilities to make it possible to do all kinds of measurements at home instead of going to a hospital for blood pressure or ECG or any type of vital signs monitoring. But this is the way. And the biggest step we took in the last few years is that we realized that if you're not going to connect these changes in our healthcare perspective to, as George told, to a big economic challenge as we look at it, that's where we can make double money. So if we look at the European programs, it's all about connecting your societal challenges into these economic opportunities. Our society is changing, and our regional government no more can argue that we only put in money for the economic perspective of companies and our professional labor market. So we're now shifting to invest in social value, which means if we can bring this together in a new initiative, and the new initiative is we build a dedicated network for innovation in healthcare. And this network, and that's where we neatly fit in the picture of the EIP as George and Donna already painted. We used the European agenda to align our regional and local policies into a kind of standard framework which we never could have invented ourselves, and even not get it accepted from our regional government. So we use the EIP to frame it and to align it in a very neat and simple way. But the big difference is that we're implementing these projects, similar projects as the NHS in Scotland is doing. We're also involved in Your Horizon, we're involved in Interact. But it's always in a triple helix approach. So every initiative we take in our region is always private organizations, private companies, research institutes, and public bodies like local and regional government. So it is the kind of a holy grail that will never do any step towards Brussels if we're not carrying any type of businesses in the driver's seat. So it's always about how are we going to invest, where are we going to invest, and is there any company involved, and it's not only Philips, to make sure that we by the end of the day can make a little buck out of that. And obviously we're using the same tactics as Scotland. We're also closely connected with the European Commissioner by that time, Nelly Crooks. We use them on our local to profile ourselves to make sure that you get the right exposure, because we're also struggling as a region to get a kind of visibility with our national government. We're also fighting with some funding on a national level, so that's quite similar, and I think we're more or less using the same type of tactics, and that's also the reason why we recognize these similar stories. Although the network, and that is actually we started it aligned with the EIP, it is the Innovation Network for Active and Healthy Aging, and that's actually also the payoff of the EIP when they originally started with. It's all about how are we going to make technology relevant in these disruptive changes in healthcare, but on the other hand, how are we also going to make sure that our local businesses are going to benefit from these joint efforts? So how can we make a little money out of solving our societal challenges in healthcare? That means that we are putting a lot of integrated effort on the valorization of all the outcomes we take from these European projects. So there should be always small, medium or large companies involved who take it one step further, because the big changes in our healthcare system will not be happening by public interventions, but mainly by new type of companies who are entering that market. Because this is the nice one I wanted to share with you. This is the triple helix, and this is of course where these three silos, because you have academics and you have public bodies and private businesses, and basically they should always work together in a very aligned way. And obviously in the center of gravity of these efforts there is always the patient, the citizen, the client, whoever you can call it. And people are arguing that it should not be the triple helix, but it should be the multi-helix. Well, whatever, somebody can make a nice study out of that, but basically this is our core value of operation. Always different organizations involved in the same playing field. So it's never an NHS type of effort in the Netherlands. It's always local health services, local healthcare providers, patient organizations and private businesses working alongside to make sure that we generate a kind of combined value on both societal and economic side. Even spending public money on research is only allowed, even in the bidding for Horizon calls, if we can make sure that there is always accreditation engagement from private businesses. And we put a lot of pressure on the Commission, and that is obviously one of the things you can do if you are a respected visitor in Brussels. The new profile of the Horizon program allows much more participation of smaller companies than it did in the past. In the past it was only the playing field of the big global companies who are shifting money with each other and local and the national government. But now there are dedicated programs which will allow you to involve many of these small businesses also here in Liverpool to participate in a way that it even makes sense for them to join. Because if you want them, if you don't have the instruments to fund the other 50% of their research efforts, you'll just forget it, because they're never capable of entering these projects. If you have ever worked together with an Interact project or a Horizon project, you know what the burden is, the legacy, which the stress it puts on your organization. If you have a first and a second level controller from Lille visiting you with 2 different accountants every year to value and to certify your financial administration, all the reports you have to bring in. I mean, that's a hell of a work, and you have to do that in a very professional way, and you cannot do that only for one project. So there you have to join forces on a regional level, make sure that there are some bodies dedicated and professionally specialized in running these type of operations, because otherwise George has 9 people, but you need already 3 only to make sure that you are compliant with all the regulation in place to only get a little chunk of the money in such a project. So that again, you should look at it as a kind of business. You should have a shared service center which runs the financial side of these projects, and then the researchers put them in their own space and let them do what they are good at, but not try to combine these, because then you end up with a lot of mess. It costs you a lot of money, and it also damages your reputation if in Brussels, if a project goes down the drain, you get one chance to recover, and otherwise it loses you. If George was about to fail in one of the projects, I mean, you can have a fail on the outcome in research, that's no problem. But it has to be compliant, because these politicians, they have only one thing they are very, very interested in, and that's nothing happens which is going to damage their reputation in Brussels. They have to be transparent, they have to be in a very accreditable in the way they operate, and that's where you have to help them. And you have to realize that you take also a big responsibility if you enter in these kind of corporations. So what we do, and I'll just skip, but because you'll find it in the sheets, and Donna already mentioned, so that's only for study for those who are interested in, but it gives you a little outline the way we organize that specific cooperation in the Eindhoven region. Gives you also a feel what we are organizing together and who is involved. And again, not by coincidence, when we started in 2012, and I had Nelly Cruz as our founding chairman in that meeting, we neatly aligned it specific with these 3 major themes that the European Commission was then more or less deploying in the year of the healthy living year, or the year of health. So it's also about a very practical way, try to embrace some of these European themes and make sure that they fit and align your local policies. And then you have a kind of a free ride, because everything communicated by the European Commission also neatly fits in your own profile. And you can use all the content you get from Brussels to enrich your local flavor and also your local, because if you have to invent that all by yourselves, you already left these 9 people in their office day and night, and no project started already. Well, of course, governance models, I'll just go over. Another thing which we definitely learned, the initiative of our innovation network is mainly focusing to get away from all these local proliferated initiatives. Every hospital, every elderly care, every handicapped care, every bunch of GPs is running their own innovation projects, and it's a little money here, it's a little money there, and nobody is building the kind of critical mass to make sure that it is, by the end of the day, pushing through and also being accepted as a kind of standard. In the whole e-health spectrum, there are a number of promising innovations also within the AAL program. There are like 50, 60, 70 small and medium enterprises with all kind of promising innovations, and nothing is happening because it all sits there, because it has been developed with small number of customers here, small number of customers there, but there's no critical mass. And if you want to make a business, you have to have standard. You have to standard operation, you have to have a kind of standard on interface, it has to fit in your hospital systems, it has to connect in a standardized way, it has to comply with some basic standards of integration in your ICT framework. So that's not going to happen if you're not building critical mass. And one of the things we learned both from UK and Scotland, if you're not driving large-scale type of demonstration projects where you find the right number of people which deliver you the type of evidence you need to convince either NHS or health insurance that there's a disruptive changes can make a benefit both for patients and for those who are financing. So that means that these testing grounds have to be big, they have to be deployed in a very substantive way. And we try, more or less, we are refraining from too much small local initiatives, because it's a lot of effort and money spent which is not delivering value. The second thing we learned is that you have to involve other type of people outside your medical perspective, outside of the public perspective, from disciplines like people who are used to look at behavioral sciences, people who are in a different disciplines involved in designing interfaces, interaction with people in all kind of phases of their life. So that's a kind of creative industry which is very much difficult to converge with a technical type of university. But if you can cross these different disciplines in your innovation initiatives, then you will find the right outcomes, because they are used to think in terms of end user behavior, end user demands, and how daily lives would react on all kind of technology which is being delivered. And the third thing we did is we created some flagships. If you are starting these programs, small or big, you have to have some examples where you can deliver the tangible proof that things are working and things are happening. Because you always have in all these change projects, you have these early adapters who are on the forefront of the change, but you also have these slow dogs, they just wait and see what's going to happen, who's going to take the risk. So make sure that you, and then again, it is about critical mass. And some of these large-scale initiatives we started are all about joining efforts on shared services in ICT. Every one of these healthcare organizations, every hospital was used to run its own ICT department, makes its own choices on ICT infrastructure, architecture. Everybody was building or developing or buying his own applications. So if you can move in a direction, and the first thing we did is make sure that everybody uses the same telehealth center in our region. Because if you have one point where all these IP devices are connected, it can be social alarms, can be monitoring for glucose, it can be ECG, it can be any type of device you can connect via the internet to a telehealth center. So we managed to organize it in a way that now all healthcare providers in our region are using the same telehealth switch to organize their alarm and all their proceedings in terms of distant monitoring. And that's an important one, because that is where you're going to standardize your regional infrastructure, instead of everybody using its own center, own telehealth standards and own type of interfaces and connectors. So that's an important one. You can find some information on the internet for that. And then you start delivering tangible proof. And tangible proof is not only the fact that things are working, but also that you are delivering economic value. So you have to show with substantial figures. I mean, it's no small money, but that doesn't give you the real conviction. But by delivering real savings, we managed to make the next steps of convincing people that we have to move together instead of everybody moving on its own pace. And we are using these European projects in a very selective way. Just as George mentioned, we have a dedicated vision on where we want to move and where we don't, and where we think that others are better positioned to take that. And then we are investing, and then we use these projects to use them as a kind of a head start project, find some early money to start initial research. But more important, use them to get exposure for these initiatives, both in your own country, but especially also in Europe. And if you do that in a way that private businesses are involved, it's also about their exposure in their foreign markets. And that's, of course, for an SME very important. If they can use your European projects, which is a very cheap way of putting yourself on the European stage, instead of, as a small company, try to conquer Europe here from your Liverpool office. Because George and myself, we are natural ambassadors for those entrepreneurs who are delivering these promising products and who also participate in these projects. Well, just switch over. This is also one of the, as we have a private system of healthcare delivery, we have many competitive organizations in the same region. And everybody is competing, but also in those parts of your service where you are losing money. For instance, during nighttime, during weekend services, you all have to make sure that you have availability 24/7, but we all do that for a limited small number of patients. So again, then we also introduced the idea of sharing people instead of everybody employing their own people in these type of services. So we are moving into a kind of a share model in many different directions in our region related to healthcare. Organizations have to start sharing ICT instead, everybody deploying and also investing in their own ICT assets. It's about sharing personnel in a way that it makes sense to make, on one hand, make an interesting job for everybody working during nighttime, and also make sure that we have the right people available related to the number of clients that we are serving in the region. So the share economy in many different instances is introducing itself in the way we organize ourselves. And obviously, if you do that, you have to change your regulatory systems, because if you are taking out a nurse who is doing a kind of local community watch and you are substituting that by 24/7 sensor monitoring, well, the system, of course, will not allow you in the first step. So that is where we put in pressure from Europe on our national government to make sure that we get a kind of exempt status in our region to temporarily being relieved from traditional rules from inspection, so that we can do these large-scale e-health type of deployments. And then you need the interaction with your region, with your national Ministry of Health, because if they also reckon that you are in an innovative way helping to change and also solve their problems, then you can get the kind of recognition that will help you to lift these rules. I think this is the thing I mentioned. This was our breakthrough flagship in the region. So everybody now in hospitals, home care, elderly care, handicapped care, even GPs, everybody on the same telehealth switch instead of running their own businesses. And they are serving now like a few 100,000 people connected with social alarms, very basic to very expanded 24/7 video monitoring for epileptic and other type of patients, partially supported at home. So that is more and more integrating. And again, this is only kind of a back office, because at the forefront, these organizations still compete with their own services in a competitive way, and they have to serve their own clients. So we're not taking out the market mechanism from our system of provisioning, but we try to do that in a more efficient way behind the scenes or under the bonnet. Well, that brings me again back to the European perspective, as already been touched by Donna and George, we are very selective in what we do and what we don't. We only move if it fits to the content or the themes or the policies we have and the programs we are trying to put ahead. If you are looking for money, only for money, and no interest in the content of these Horizon calls, if you cannot argue yourself that it fits into your broader picture of research for the region, just stay away, stay out of it, because you will not win the bid. And even if you win the bid, or you probably will lose it, because you're never capable of managing that over the next 3 years, because there is no commitment on the content of these calls, and that's actually what you need. If the academics are not the guys who wrote the proposals in line with what you are planning as a region, then just leave it. And again, you also have to reflect every year again what your efforts are and how are you going to proceed. Because it's not a lifetime marriage with all these instances in Brussels, because there are also changes there, and every 4 years you have elections and you have different nuance in the way Brussels is organizing itself. You get new MEPs, which you probably are connected via your national government. So it's also about always look in the mirror and question yourself, what is a reasonable effort which has a mutual payoff, both for yourself but also for Brussels. And you have to be very practical in that one as well. We all reckon the traveling scene in Europe, all these visits, we are managing that down to the level what is really necessary to keep a project running. Because in the first years we were actively participating. I sometimes have all of my staff traveling like 4, 5, 6 countries every month, and of course that's a crazy idea. It's nice if you have young people in your team, but after a certain period of time you realize that it's not going to deliver any value, so you just learn that. Sometimes you just enjoy it for a short time and then rationalize it and refrain from it. I can say that it really helped us to change the definition of the Horizon program. We get a lot of recognition from local businesses, I mean beyond Philips, about new ways of participating. We also realize that if you have these 400 startups in this area, you also find new mechanisms how you make it possible for small companies to engage in European projects. So we made, we are a legal entity as an innovation network, so I am entitled to sign for these programs, but I have a kind of reallocation behind our organization with these small organizations. So I take out part of their burden of defining and developing a proposal. I only take them in for the part of the work where they are interested in, and I also assure that I find the kind of co-financing money in our regional government to make sure that I'll make it possible for them to engage in a way that they're more or less covered for their cost. So it's a very, it is like a market situation which you have to bear in mind if you look at Brussels. And for us, it's not an isolated policy, it's an integrated policy of economic development, and then also Brussels is one of your business lines which you should incorporate and also drive it in that way. Well, and I think I can say that out of these EIP projects over the last few years, we now are starting to deliver real promising new businesses which I personally took a few of them to San Francisco to find other type of investors, because sometimes also the Netherlands and Europe is getting too small for these new big steps. So we have a few, and they are only kind of best practices as I use them to show that out of these initiatives you will delivering new type of companies and they find their way in Europe or in the world. This is one, they have a very successful IPO in the US on skin monitoring, so you do like early stage detection of melanoma. So, but it's just for the sake of an example. And it all started by entering like 20,000 people in our region in the first 5 field trials, delivering a critical mass to them to start their app and to optimize their app by using a large-scale data from that group. Well, and I think this is where I probably will end my presentation looking at our schedule, but bear in mind there are other brands hitting that market. It will not be longer Philips and Siemens and the traditionals. You will be facing with the Apples, the consumer brands who are more and more starting to enter this space, and especially if all these devices you are well aware of, and I'm a Star Trek, and that also gives you a little hint on my age. I was in San Francisco at the guys of Scanadu last year, and they launched their new product via a crowdfunding platform. They got like 5,000 supporters who all bought the first edition of this Scout. And this Scout, and I have one myself, but it's not regulated yet. So what they do is very neat. They shipped it to 5,000 customers, and the only thing you can do with it is use it for trial purposes and deliver your data to Scanadu, and they optimize their algorithms with the data you are providing. And they organize themselves with 5,000 ambassadors over the world. So you'll see all kind of new interesting models starting, which can also help you changing perception within your own region, or for instance in an organism, because this is what you can do with a Scout, and you give that to an internal doctor, and he'll start arguing that you will never be able to do an ECG on a non-invasive basis. You will never do blood pressure in a way that is clinical trustworthy. But it is there, and technology will make it possible for like $100, and that's a different amount than you look at the same medical device in your local hospital. And this is only the forefront of a whole new era of products which is gradually starting to hit the market. And eventually all these separate devices, they'll end up in your smartphone. It's only a matter of time with all these sensors, because it's all about sensoring and algorithms. How do you interpret the data, and can you make a reliable reading out of that? So by the end of 2020, you will see that most of these devices, even Scanadu Scout, will simply end up in your smartphone. So always think in terms of that model, in terms of the apps you are already using, and just realize that there are other forces can help you to change the pace of the industry you're all working in. And sooner or later, we'll all be more or less compliant with all these new medical devices. So, well, and basically that was my small contribution for tonight. Thank you.